Hi, everyone. Hope you're all doing well. Just wanted to go over our information from last week and then talk a little bit about this week to come. Hope everyone had a good holiday and found a little time to relax with friends or family or something. I'm sure everyone's holidays were probably a little muted as compared to the past, but hopefully you had a good couple of days. So last week, the week that just ended, we were looking at a few different things. The policy implementation perspective, looking specifically at how we take something from that legislative side, choosing to move forward with a policy, and then actually putting it in action. So, creating programs based off of it, or those types of things. Just getting an idea of kind of how that whole process works. So in our discussion, obviously looking for policy based on wherever it was that you were looking to, if you wanted to look at something federally or statewide or locally or whatever, finding different policy proposals. And then also we had a case study based on some reform that occurred in Massachusetts. I find there are several states that tend to be on the cutting edge of reform with regard to healthcare. New York, California are two, especially that really are always on the cutting edge. But the New England states tend to be fairly cutting edge as well, mainly because they tend to be states with a more liberal government structure. Democrats, typically Democratic, and so they tend to be more focused on providing services to people as opposed to a Republican side that tends to be less worried about providing services to people and more about a hands-off government type structure. So I think that's why we see more out of states that are in the New England area, as well as um, you know, like I had said, New York is very much on the forefront. California, but again, fairly liberal governments in those areas. So it makes sense. I don't anticipate seeing the states in the kind of the middle of our country being at the cutting edge of these types of things, just because they tend to be more of a hands-off government type you know structure within that state itself. So hopefully you found that interesting, and I look forward to taking a look at those. This week to come, we're talking about a couple of different things. Still kind of talking about health policy implementation, but then also I wanted to kind of bring into play pharmaceuticals. So in our chapter 10 in our textbook is about the pharmaceutical industry and their impact on health policy, and how we can kind of even create some reform with regard to pharmaceutical policies. I know that some of you are actually planning on doing your projects on the pharmaceutical industry, specifically like the Medicare donut hole, which is kind of the gap in coverage that many Medicare patients face if they get to a certain amount of expenditure with pharmaceuticals. And I just have a personal example. My physician just recently put me on a new migraine medication called Emgality, and so Emgality, my health insurance is there through RMU, and it's got I think a $3,500 deductible that I would have to pay um, prior to getting any coverage for anything, pretty much, except for well care. So I submitted the prescription to the pharmacy, or the physician did, and was notified that it would be almost $1,700 for my first month's coverage of Emgality. So that's just an example. That's 1 month of a new medication that would actually work to help and keep my migraines away, so that I didn't have to take other medications to deal with them. So I, of course, don't have $1,700 lying around to get it. And luckily, and we're seeing this with many pharmaceutical companies now, the pharmaceutical company had um, kind of a process, or a discount card, where they would cover some of that for you, and discount the price. So my first month's Emgality was discounted to zero, so I actually didn't have to pay anything. And actually, it just popped up here a moment ago as my next refill. and it came through, and it also is zero because Emgality is picking that up. Now, they don't do it forever, and I will have to start picking up the cost of that at some point here in the future. But it's nice to have, especially when you have people that are taking a medication, maybe to try it out to see if it works. It can be very, very expensive, especially if it's a newer medication where there's not a generic equivalent. So it'll be interesting this week for you, hopefully, to read through about the pharmaceutical policy issues in the textbook, and also read a little bit about reform and how that works. We also do still have some implementation information in this week as well. I have added this other video with regard to writing a policy brief. So this is, something, I guess it technically would be optional. You don't have to watch it. I guess, we ask you to take part in all of it. I guess it's all optional. If you choose not to watch it, then you don't. But it might be helpful if you're struggling at all with the structure or format of the brief, or how you put that information together. And there have been, I think back in whatever week it was, when we chose topics. When was that? 2 weeks ago, maybe. Last week. I don't remember. It may have been week 4, where we chose topics for the final project. I think there was some policy brief stuff in there as well. So it's a little different than the writing format that you might be familiar with, but it still has to be an APA format as far as citations and references, if you are citing or anything. Obviously, if you're, I know some of you are taking an existing policy and making improvements to it, looking to implement new things that would improve that, the impact of the policy on the population that you're looking at. So in those cases, you could very well have some citations throughout. Remember, you need to put your citations throughout the paper itself, your in-text citations, and then your reference list at the end. So any questions on that, please just let me know. But there is also this video to kind of give you some insight there. In our discussion this week, we're going to be looking at the country planning database. I'm just going to hop over here. Hopefully the link works. See, it's not going to work. Let's see. I'm glad I clicked into this. So for now, until I fix it, which hopefully before you see this, I'll fix it. If you just go back to the top and click country links, and then planning cycle, it'll take you to the page you want to be at. The problem is people change their URLs so quickly. I literally did this in the first week. I added this link in the first week of our class, and now 6 weeks later, it's broken. So, so you'll want to choose a different region. So let's see. I'm pretty sure I told everyone not to do the United States. And I'll give you an example here why. It's not going to let me dig in any further. I'm not sure why it's not. It's not as dark as it should be here. I'll fix the link so you can get to the right sites. But as you can see down here, there aren't a lot of countries in the Americas. So obviously, we're looking at this part of the world. There aren't a lot of countries in here, with us included, right there in the middle, that take part in these processes, and I think that in itself is somewhat telling. So, there is some data here about national health planning and whatnot, but like for example, there is only one country in the Americas, so noted across all of this, North America, Central America, and South America, that take part in these reviews on an annual basis. So there are plenty of countries that just don't participate. But as you'll see here, I suggest that you click a country from the drop-down menu, and I'll fix this so that you can easily get to the countries. But if you obviously right here, for example, we have Afghanistan. You can choose any one of the countries. Like here is where you could choose the United States, which I asked you not to choose, so don't choose the United States. But as you'll see, there's not a ton of stuff in here and most of it's out of date, with the exception of the HIV/AIDS plan. So it's not, stuff for our part of the world is not terribly robust. But you could choose a country such as, right here, the United Kingdom. So you could choose a country such as the United Kingdom, who has a bit more detail and more information in here. So you'll find info throughout here, but then what you'll also find is if you click this file repository, it will take you to their files. So here is a framework for action with regard to aging and health plans. It's from 6 years ago, but it's likely probably something that they're still, still working toward today. So just you're going to want to choose a country, examine the health policy strategic plan priorities. Information's in the documents in that file repository, and talk about those priorities. So I'll say, please don't choose the United Kingdom because obviously they don't have a ton of info here, and we've just looked at it. But you could open this if you did choose the United Kingdom, for an example. You could open up this document, and it's going to talk to you a little bit more about what it is with regard um, to fuller working lives, looks like kind of focused on older people, what it is about their items that they're looking at that can impact that population. So, what are the goals and objectives? How will they implement? How will they monitor progress? How does this differ from what we've learned throughout the class about the U.S. healthcare system? So again, there's not a lot of data here, but you could certainly answer those questions out of this document here if you were to choose the United Kingdom. So I'd encourage you to kind of dig around in the looking at the different all of the different countries available there, and see what you can find, and hopefully that will be you'll find some interesting info. Also, there's a final project outline due this week. So again, it's just an outline, but I'm kind of hoping that by asking you to submit an outline and asking you to submit your choice of topic up front, that it will get you working on this over a few weeks as opposed to cramming it in the last week or in week 7, which is what a lot of folks do. So hopefully this can get you on the right track, but you'll want to kind of lay out the framework of the policy brief. I'm talking about these different pieces. Again, you can watch that video. It can help to provide more information to you as well. And then you'll submit that this week. Now, I will say, don't wait for me necessarily to provide you tons of feedback on this before continuing to work on your project, because your project will be due at the end of week 7. But I will obviously make these my priority to get these graded and back to you with some commentary as quickly as possible, especially for those that I've asked to kind of shift their policy topics a little bit. Some had chosen some areas that weren't necessarily public policy, but were policies within a healthcare organization. So we want to make this as a public policy brief, and we're trying to shift to that area. So I'll try to make sure I can get to them as quickly as possible next week as you submit them, or over the week as you submit them, so you can work on your brief, which is going to be due next week. And then your quiz will populate later today, so you'll see that in a while. But so that's all I've got. Any questions, as always, please just let me know, and I look forward to seeing you in the classroom. Thanks.